Hi everybody, I'm Dr. Seth Eberlin. I'm a board-certified plastic surgeon here in Walnut Creek, California, and today we're going to be talking about liposuction. Now, liposuction is a pretty general term, and it's a procedure that can be performed almost on any part of the body, but the whole idea of liposuction is we are sucking out fat cells. That's pretty much it. Now, the idea behind fat cells is it's almost like a little reservoir for energy. When you gain weight, that reservoir fills up. When you lose weight, that reservoir deflates, but the reservoir is always there. So by doing liposuction, we are permanently removing those reservoirs. One question I often get with liposuction is, if I do liposuction and I gain weight, am I going to gain it in weird places? The answer is yes and no. I've seen this happen once with a patient who I did a lot of liposuction on, and then she, over the course of a few years, gained about 50 pounds. And that fat did come back in different places just because she had lost those reservoirs in a lot of her main storage space. I've been doing this for a little while, and I've only seen that happen once because most of the time patients aren't gaining an excessive amount of weight after surgery. So I usually recommend, look, if we're going to do surgery, let's make sure we're at a stable weight. It doesn't have to be at your goal weight, but I want your weight to be stable because we don't want fluctuations too far one way or the other, because that can affect the way that your skin lays after we do a surgery. The other thing about liposuction is, will the fat come back? No. Once that fat is gone, once those reservoirs are gone, they are gone. Your body is not going to grow new fat cells. However, again, if you do gain weight, the reservoirs that you still have are going to fill up. So you are still able to gain weight, but the fat cells that we removed will never be regenerated. The other thing I get asked is, well, where can I do it? And you can't do it everywhere from head to toe, but almost. We do a lot of liposuction in what we call the submental area, or for the jawline. You can do liposuction of the arms, that kind of the axilla or armpit area. For men, doing liposuction of the chest works fairly well. Kind of the abdomen, the sides, the back, the thighs. All these areas, and the calves even, all these areas are areas that we can treat with liposuction to address shape and contour. Liposuction is not a weight loss procedure. So I tell people, look, don't expect the number on the scale to plummet. I'm not looking for you to do liposuction and all of a sudden you're 20 pounds less. This is much more of a shaping and contouring thing. This is for addressing stubborn areas of fat or areas that just genetically, this is the hand that you were dealt. Some patients have, more definitive love handles or kind of volume on the side. Some patients have a heavier jawline, and that's just where their body developed that fat. And this is a really good way of removing it. So we're kind of emphasizing the shape of what you have, as opposed to, again, looking for the number on the scale to go down. Now, liposuction recovery is, we'll call it deceiving, because it's little incisions. You can do liposuction through about 3 millimeter incisions. So from the outside, it doesn't look like it should be very long recovery, but we're treating a lot of surface area when we're doing liposuction. So there's a longer recovery to incision ratio. The process that we go through with recovery is, if we have your skin and we have your fatty tissue here, we do liposuction and we remove that fatty tissue, and then your body swells, and then the swelling resolves, and then your skin tightens up a little bit. And that's a process that we go through every time we're doing liposuction. So usually around a week after surgery, people are finally starting to see some results. But for those first few days, you look a little bit fuller than you did before surgery. And that's just because your body's replacing the volume that I took out with swelling. And we just have to let that swelling go away. The good thing is you can treat a pretty broad area through a little incision. So liposuction incisions can and should be hidden in very inconspicuous areas. Oftentimes we'll put them in the belly button or in creases. Like you can put it in the armpit crease. You can put it underneath the earlobes. They shouldn't be in obvious areas. And that is a pet peeve of mine when I've seen patients who've had liposuction and they just have incisions going all the way down. And I'm like, these are not placed in a proper position because it makes it obvious what you had done. Liposuction is one of those procedures where you can have it done and have it be completely hidden for the rest of your life. Other procedures, if we're actually removing skin, then yes, there's going to be a longer incision and it's going to be a little bit more challenging. Like for a tummy tuck, for example, you can hide that tummy tuck incision underneath underwear or a bathing suit, but that incision is still there. With liposuction, they should be hidden in skin creases, in belly buttons, in tattoos, in freckles. Anywhere where there's already a little bit of a kind of a pigment change or a contour change is a great place to put them. And I spend a lot of time figuring out where I think the best aesthetic kind of hidden areas are. Now, liposuction can be combined with a number of other procedures. I do it a lot if we're doing a lower face and neck lift. We do liposuction to the jawline. If we're doing a tummy tuck, we'll do liposuction along the sides. In addition, you can transfer that fat places. So just because we're removing it from one place doesn't mean we have to throw it away. If you're doing liposuction, we can transfer it to the face. You can transfer it to the breast. You could transfer it to the butt. You can even transfer it to the back of your hands. Anywhere where we might be needing a little bit more volume or to kind of restore and refresh the skin, it's a really effective way of doing that. Liposuction is done as a standalone procedure, but very often it's combined with other procedures just to kind of augment or enhance those final results. So if you have any questions about liposuction or any associated procedures, don't hesitate to reach out.